Welcome back. Our guest this morning is Dr. Niessen, who's the Dean of the KCU College of Dental Medicine. Welcome.
Thank you. It's always nice to be here.
Good to see you. Good morning. We are talking about teeth sensitivity. I was just telling her in the commercial break, this is right up my alley. I deal with this literally daily, because once you start to feel it.
Yes.
So, all right, so where do we begin? What is sensitive teeth?
So sensitive, you have the enamel on the outer layer, hardest substance in the body, but as it wears away, the teeth can be sensitive. So it can be sensitive on the top part of the tooth here, we've got the top part, or on the root surface. The root surface is covered with cementum. So when the gums recede, you can have sensitivity on the part of your gums.
Yeah.
Now, there's different kinds of sensitivity. Sensitivity to hot,
I was just wondering,
is the big problem. That means you have nerve damage. You probably will need a root canal.
Oh, no.
Oh, yeah, that's serious.
I don't have that, thank goodness.
Good.
You're bringing me the good news this morning. Okay, but I am sensitive to cold.
Sensitive to cold usually means the teeth are subject to trauma of some type. After you have a filling, your tooth could be sensitive. After you get your teeth cleaned.
Oh, yeah.
You know, if we remove all the tartar from your teeth, you know, I've had patients call and say, why are my teeth hurting? I just had my teeth cleaned.
Yeah, no kidding.
Well, because we've removed the tartar that's protected the tooth in some ways. So, and then if you have a cavity, the teeth can be sensitive to cold or to sweet.
Okay.
But they can also be sensitive for clenching and grinding.
That's my problem. I don't mind telling everybody that in the 4 states. Right here.
And how do you solve it? Because you've solved it.
Yeah, so I have a night guard that I'm
right.
supposed to wear, but sometimes I wear it, if I forget it at night, I'll wear it during the day just vacuuming, just to so I'm not clenching while I'm doing something else.
That's perfect.
Yeah.
That's exactly what you should do. If you sit in a meeting and all of a sudden you see your fist clenched, that's a clue your jaws are clenched too. So just kind of relax the fist and then put the mouth guard in, which is exactly what you're doing. You're doing the right things.
Yeah. So I know that one thing we wanted to talk about is what causes that sensitivity.
So what causes it is if you have a cavity, that can cause the sensitivity. If you have the recession, that can cause it. If you over-whiten your teeth, some people like to whiten their teeth, that will cause sensitivity on both the teeth and the gums. The gums can get sensitive.
Well, and they have the over-the-counter whiteners, and if you're just kind of using them on your own, then...
And you think you can use it all the time.
Yeah.
And if your teeth are sensitive, that's a clue. You probably want to back off, you know, the whitening for a little bit. But grinding is probably one of the most common.
That's what you were saying, right? In the commercial break, she's like, do you grind? And I said, I do. So, Okay, so how do we stop that pain?
So the way we stop the pain is we look at what the diagnosis is. What's the cause? If the cavity is the cause, then we want to you know, fix the cavity. The easiest way is use desensitizing toothpaste. Use a toothpaste that, you know, will help desensitize the tooth. Use a soft toothbrush. Don't wear away the enamel. I
had that issue for some time when I was a teen.
Oh, because you used to scrub.
I think they were giving me like the medium when I would go to or I'd buy the medium, and they were like soft, 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 and soft.
Soft. As I always tell my patients, you wouldn't take a steel wool pad to clean your car on the outside because it would wear away the paint.
That's good.
It's the same thing.
That's good.
Avoid acidic foods. You know, tomato juice, oranges, lemons, they just make the sensitivity even worse.
That makes sense.
Okay. And then, you know, just good oral hygiene always makes a difference.
Yeah, absolutely. So I know that I have a note here, there might be some dental procedures that can help with that sensitivity.
So if you have, if you have the sensitivity because of recession, we can do procedures. We can put little restorations on those teeth to protect the root surface.
Good to know.
So we can do that. We're using fluoride varnish. That's helping. And then dental sealants. We can put sealants on. So we're starting to look at what procedures we can do to help patients.
I love that. Lots of things going on at the dental school, and they're learning that, and we get to learn a little bit about that as well.
And as you know, the dental clinic is open, so if people have toothaches, they are more than welcome to come.
There you go. There's the plug.
And our students are starting to see patients too.
I know, that's so exciting. So exciting. Dr. Niessen, thank you so much for joining us this morning. Now let's talk about our weather. Josh Oldham has a look at our forecast. If you're sensitive, see what I did that to the warmth. Not great today.